Welcome to Nursing Prep. Push yourself in nursing preparation with Smart Way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. The nurse in charge measures a patient's temperature at 102 degrees Fahrenheit. What is the equivalent centigrade temperature? Option A, 39 degrees Celsius. Option B, 47 degrees Celsius. Option C, 38.9 degrees Celsius. Option D, 40.1 degrees Celsius. Right answer is option C, 38.9 degrees Celsius. To convert Fahrenheit degrees to centigrade, use this formula: C degrees equals F degrees, 32, x 5 9 C degrees equals 102 to 32 5 9 plus 70 x 5 9 38.9 degrees Celsius. To evaluate a patient for hypoxia, the physician is most likely to order which laboratory test? Option A, red blood cell count. Option B, sputum culture. Option C, total hemoglobin. Option D, arterial blood gas, ABG, analysis. Right answer is option D, arterial blood gas, ABG, analysis. All of these tests help evaluate a patient with respiratory problems. However, ABG analysis is the only test evaluates gas exchange in the lungs, providing information about patient's oxygenation status. The nurse uses a stethoscope to auscultate a male patient's chest. Which statement about a stethoscope with a bell and diaphragm is true? Option A, the bell detects high-pitched sounds best. Option B, the diaphragm detects high-pitched sounds best. Option C, the bell detects thrills best. Option D, the diaphragm detects low-pitched sounds best. Right answer is option B, the diaphragm detects high-pitched sounds best. The diaphragm of a stethoscope detects high-pitched sound best. The bell detects low-pitched sounds best. Palpation detects thrills best. A male patient is to be discharged with a prescription for an analgesic, that is a controlled substance. During discharge teaching, the nurse should explain that the patient must fill this prescription how soon after the date on which it was written. Option A, within 1 month. Option B, within 3 months. Option C, within 6 months. Option D, within 12 months. Right answer is option C, within 6 months. In most cases, an outpatient must fill a prescription for a controlled substance within 6 months of the date on which the prescription was written. Which human element considered by the nurse in charge during assessment can affect drug administration? Option A, the patient's ability to recover. Option B, the patient's occupational hazards. Option C, the patient's socioeconomic status. Option D, the patient's cognitive abilities. Right answer is option D, the patient's cognitive abilities. The nurse must consider the patient's cognitive abilities to understand drug instructions. If not, the nurse must find a family member or significant other to take on the responsibility of administering medications in the home setting. The patient's ability to recover, occupational hazards, and socioeconomic status do not affect drug administration. An employer establishes a physical exercise area in the workplace and encourages all employees to use it. This is an example of which level of health promotion? Option A, primary prevention. Option B, secondary prevention. Option C, tertiary prevention. Option D, passive prevention. Right answer is option A, primary prevention. Primary prevention precedes disease and applies to health patients. Secondary prevention focuses on patients who have health problems and are at risk for developing complications. Tertiary prevention enables patients to gain health from others' activities without doing anything themselves. What does the nurse in charge do when making a surgical bed? Option A. Leaves the bed in the high position when finished. Option B. Places the pillow at the head of the bed. Option C. Rolls the patient to the far side of the bed. Option D. Tucks the top sheet and blanket under the bottom of the bed. Right answer is Option A. Leaves the bed in the high position when finished. When making a surgical bed, the nurse leaves the bed in the high position when finished. After placing the top linens on the bed without pouching them, the nurse fan folds these linens to the side opposite from where the patient will enter and places the pillow on the bedside chair. The physician prescribes 250 mg of a drug. The drug vial reads 500 mg/ml. How much of the drug should the nurse give? Option A. 2 milliliters. Option B. 1 milliliter. Option C. Half a milliliter. Option D. 1/4 of a milliliter. Right answer is Option C. Half a milliliter. The nurse should give half a milliliter of the drug. The dosage is calculated as follows: 250 mg/x equals 500 mg/1 milliliter. 500x equals 250x equals half a milliliter. Nurse Mackey is monitoring a patient for adverse reactions during barbiturate therapy. What is the major disadvantage of barbiturate use? Option A. Prolonged half-life. Option B. Poor absorption. Option C. Potential for drug dependence. Option D. Potential for hepatotoxicity. Right answer is Option C. Potential for drug dependence. Patients can become dependent on barbiturates, especially with prolonged use. Because of the rapid distribution of some barbiturates, no correlation exists between duration of action and half-life. Barbiturates are absorbed well and do not cause hepatotoxicity, although existing hepatic damage does require cautious use of the drug because barbiturates are metabolized in the liver. Which nursing action is essential when providing continuous enteral feeding? Option A. Elevating the head of the bed. Option B. Positioning the patient on the left side. Option C. Warming the formula before administering it. Option D. Hanging a full day's worth of formula at one time. Right answer is Option A. Elevating the head of the bed. Elevating the head of the bed during enteral feeding minimizes the risk of aspiration and allows the formula to flow in the patient's intestines. When such elevation is contraindicated, the patient should be positioned on the right side. The nurse should give enteral feeding at room temperature to minimize GI distress. To limit microbial growth, the nurse should hang only the amount of formula that can be infused in 3 hours. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.